Lip lifts are one of my top favorite procedures because with a relatively smaller procedure, you get a very subtle but very significant improvement in the overall facial aesthetics in general. People hear about lip lifts as just being a way to increase the volume of the top lip, and that might be true, but it really misses the mark on what it truly accomplishes. It improves the proportions of the lower face, it improves the three-dimensional structure of the lip, the volume of the lip, as well as the tooth show. This is something that can be done to rejuvenate an aged lip or to enhance even a younger patient's lip. More specifically, when we're improving the portions here, we're getting closer to that 1/3, 2/3, which we know is the kind of ideal aesthetic. This is a guideline. Not everyone's going to get that 1/3, 2/3 that's going to look good for them. When we're improving the shape and the size of the lip, we're pulling up on this area. We're enhancing the shape of the peaks and the cupid bow as well as the sides over here. We're also enhancing the volume of the lip, the apparent volume, by bringing the lip up. We're showing more lip. We're not actually adding volume, but we're showing more lip in order to make it appear bigger. We're also increasing the little bit of a slope over here, not in a negative duck lip type of way, but in a very nice, aesthetically pleasing, youthful, and kind of pretty lip type of way. It's something you really have to see to understand, but it's a very subtle slope and then slopes back down into the lip. The way that we accomplish a lip lift is, yes, we make an incision underneath the nose over here. We do have to design it properly by balancing out all those benefits. For example, you don't want to lift it up too much in order to get too much show. You don't want to make the lip too big, and you also don't want to make this too short. We balance all of those and we figure out just the right amount to take out for that specific patient. We also have to account for the fact that if we lift up here, we have to lift up even more here because this is lifting up at an angle when this is lifting up straight in order to avoid that over lifted center appearance. We also have to take into account a thinner nose to a wider mouth base. If the mouth is too wide, we have to understand that we're not going to recruit the corners of the mouth. And if that's a significant issue for that particular patient, we have to do a corner lip lift as well. The way that a procedure is done is very similar to a dental procedure. In fact, usually a lot easier because you don't have to lay there with your mouth open. We do a few little injections over here. They numb the top lip. Yes, there's a little bit of a sting and a burn, but the procedure itself, patients feel nothing. They're calm, they're relaxed. They have a little bit of medication on board. Not enough to be any sort of danger, not like a colonoscopy, but just enough to relax them. Once we do the procedure, they have little stitches down over here. It may be a little bit sore, but it's not something that can't be controlled with a little Tylenol. They're swelling after the procedure. It gets worse over the course of about 24 to 48 hours, but usually around day 2, 3, 4, it significantly declines. And around day 4, 5, when we take the stitches out, yes, they're still swelling, but most of the time we see that our patients are very comfortable in public, meaning they're not afraid to go out and show their lip for fear of patients or other people looking at them and thinking, oh my God, are they having an allergic reaction? Again, every patient's going to differ, but usually it's that day 5, 5, sometimes 6, that's the magic number there. After the procedure, the results are pretty immediate. Once the swelling goes down, you see the end result sometime 2, 3 weeks later. Swelling will continue to go down over the course of about 2, 3 months. It's not the type of swelling that patients are waiting for it to go down, but it's something to be aware of that you may lose a tiny little bit of volume. And that goes out, for several months, sometimes 6 months. But overall, pretty simple and easy procedure and very satisfying if done properly.